Hey guys, Maria here at Langley's Vital Nutrition Center. I'm a nutritionist here, and I just wanted to go over this study. It's called Iron Homeostasis in Rheumatic Diseases. So rheumatoid arthritis, gout, osteoporosis. It's pretty alarming what they have found. So I'm just going to read some of my bullet points from it. Excess concentration of iron can present both oxidative stress and elevated risk for infection. As a result, the human has evolved to a complex mechanism of regulating iron and limiting its availability. This is done through the iron recycling system. Autoimmune diseases and gout often present with abnormal iron homeostasis. This means that there's too much unbound iron in the blood or in the body in general. So that could be stored in your joints, your muscles, organs, bones. So we conclude that altered iron homeostasis may present a purposeful response to inflammation that could have theoretical anti-inflammatory benefits. We encourage physicians to avoid routine iron supplementations and those without depleted iron stores. And let me add, they usually think that we're depleted in iron because they are measuring ferritin, which is not a good measurement of iron. So more about that later. Look at my previous video for why we're not anemic and why iron is not good in our diet. So another key point, iron is insoluble at physiological pH and can be toxic to living cells and tissue through a generation of oxygen-based radicals known as oxidants. So oxidants are going to wreak havoc in your body. It's basically rust. We want antioxidants to help get that out. Absorb 0.1% of the total body iron from the gut. There is no excretion mechanism for iron. Our body recycles 99% of iron in our body or that we consume. So we really don't need much from our diet. Iron overload can be associated with changes in the immune system. Iron is also critical in the ability of an invading pathogen to survive in a host. So this is one of the reasons why our blood pushes iron out, because it's protecting our blood from pathogens. Presence of iron and the ability of the organism to utilize one or more of these mechanisms in different hosts can determine microbial proliferation and infection. Host homeostasis becomes critical in the protection against these pathogens. So just reiterating on that again. Anemia occurs despite normal or elevated total body stores of iron, and it is not correctable by supplementation alone. Macrophages can transport iron away from the microbe, thus limiting its growth and survival. Increased susceptibility to autoimmune diseases such as RA when there is too much iron in the body or blood. Hepcidin synthesis is greatly increased during inflammation. Iron supplementation could increase the risk of infection in certain populations. Human immunodeficiency virus show that elevated iron status predicted increased morbidity and mortality. So too much iron, not good. There's little data to support or refute a benefit of this process in those with autoimmune and other non-infectious inflammation. So do not do iron infusions. Studies have demonstrated worse clinical outcomes in certain populations receiving blood transfusions and intravenous iron. Increased mortality. Markers of inflammation are increased in patients with chronic kidney disease who receive intravenous iron, which is iron infusions. Rheumatoid arthritis. Patients with RA have higher concentrations of free iron, lactoferrin, and iron-binding proteins in SF related to those without the disease. Iron chelating agents has been shown to benefit in reducing inflammation, soft tissue swelling, and erosions. Early studies in humans suggest a negative impact of iron supplementation on disease activity among patients with RA receiving iron dextrin infusions for anemia. This causes a worsening of symptoms if you get iron infusions. I'm sorry guys, this is long, but it's important. 9 of 10 patients with RA who receive iron dextrin infusions had exacerbation of joint dysfunction associated with an increased ESR. A number of small studies in patients with RA have demonstrated some improvement in the disease activity with treatment with iron chelating agents. Chelating is where it pulls the iron out. Our recent review reported that iron intake could function to aggravate lupus, and a case report describes worsening of disease activity with iron infusion An iron-deficient diet resulted in improvement in urinary protein excretion. Patients with lupus have been shown to have dramatically increased risk of atherosclerosis and cardiovascular disease. Some evidence would suggest that relative iron overload is an adjunctive risk factor for cardiovascular disease. Let that sink in. Elevated hepcidin levels due to inflammatory may result in sequestration of iron in macrophages within atherosclerosis and may result in accelerated growth of plaques. It is possible that supplementation in this setting could result in increased hepcidin levels and worsening of the phenomenon, thereby exacerbating atherosclerosis in this disease. Several studies suggest a role for iron in triggering of flares of gouty arthritis. Several of these endpoints improved with iron chelating therapy. Phlebotomy to reduce iron stores in near iron deficient levels improved flares of gouty arthritis. A decrease in urate complex iron decreased oxidative stress or possibly an immunosuppressive effect on relative iron deficiency. Kind of back to RA. So ferritin levels below 60 to 100 may be a useful cutoff to distinguish true iron deficiency from ACI. Patients with ACI alone should not be routinely provided iron supplementation. We would actually like to see ferritin levels quite a bit lower than that, like way lower, just so you know. So this is shooting on the high end. So to summarize, supplementation of iron could potentially have a negative impact on disease activity in these conditions. Thank you guys for being patient and listening to this. I did summarize a pretty big article for you guys, and please second guess when people tell you to include iron. Talk to us in the office, work with me for this protocol, and Jeff as well. Thank you.